Hello, I'm Dr. Michael Wright, the Chief Medical Officer for Avant. I'm joined today by Ruanne Brell, Senior Legal Advisor. Hi, Ruanne.
Hi, Michael.
Medicare and the rules and requirements associated with it can be complex, and in this series, we're looking at the common questions that Avant members have asked us and what you need to know. In this episode, we're going to talk about care plans and what you need to know to ensure that you're compliant when preparing these for your patients. So, Ruanne, as a GP, I've got a complex cohort of patients. I think nearly all of them need a care plan. Is that okay, or am I going to get audited?
Probably not all of them need a care plan. It doesn't necessarily mean that you're going to get audited though, because that might be specific to your patient cohort. The most important thing is to be aware that chronic disease management plans and the item numbers associated with them have been heavily scrutinised by Medicare in recent times. Therefore, you do need to ensure that your records meet the requirements for the item number that you're billing for that plan, and that's detailed in your documentation for those consultations. As a starting point, the usual treating GP for a patient is best placed to be providing the plan.
You mentioned that about the usual medical practitioner. So what about if a practice that I'm working at just books a patient in for a care plan and I haven't met them before? Is that appropriate?
The easy answer to that question is no, because you as the doctor need to be able to see that patient to determine that the care plan is appropriate and clinically indicated for that patient. It's important to remember that Medicare is based on what your peers would consider was appropriate billing. So you would need to consider whether or not a care plan was clinically relevant and appropriate for that patient. Sometimes we do know that patients contact a practice indicating that they need a care plan and specifically ask for that. And so it's best for your staff to know that if they are faced with that sort of request, just to explain, look, I can book you in for a consultation, but the doctor will need to decide whether or not a care plan is appropriate and whether one's issued at that time.
Can we use templates or can we use macros?
Look, templates and macros do have a place in providing care plans, but they have been heavily criticised by Medicare regulators because if used poorly, it can lead to a generic record being generated for that patient as their care plan. And that might lack the sufficient sort of specific detail and individualised detail to justify being able to bill the item numbers required for the chronic disease management plan items in those situations. The plan is also not only a clinical record, but is also a billing record. So you need to make sure that that care plan includes enough detail to justify all the requirements of the particular item number. In your experience, do you use templates to use?
We've got a basic template that actually sort of outlines the categories of information that you require, but it's got to be individualized. I mean, you particularly need to have what the patient's needs and goals and priorities are, whether it's a chronic disease management plan or a mental health plan, to certainly make it individual. And if they're being referred, whether it's to a psychologist or to another allied health professional, they need that information to make the referral process valuable as well.
And just to add to that, the Professional Services Review have said that a chronic disease management plan item number should not be billed by a GP on the first or second visit. It's because their view is that it's very unlikely as a GP that you would have formed sufficient knowledge of the patient's condition and circumstances to be in a position at that point in time to develop an individualised plan. The other thing that's noted is the doctor issuing the plan, or at least the practice, must have provided the majority of the patient's care over the previous 12 months or will be providing that care for the following 12 months. So that's the other thing just to be aware of when using any of those care plan item numbers.
Okay, I mean, that's really good to know. Yeah, so it's not like a patient comes once and they should have a care plan. It sounds like the PSR is saying they should not have a care plan in that situation.
Correct.
Well, thanks for joining us, Ruanne. That was all we wanted to talk about in care plans today, but please join us soon to more of these webcasts about the ins and outs of Medicare.